So, anyway, just read this. I really don't, other than what we've already said about HIV and AIDS, I really don't have a lot more to say about it, unless anybody has any questions about it. New? Okay. Fun fact, I think that is on here. I believe it's on here somewhere. Maybe it's not on here somewhere. Was it on the last slide that I just didn't? Oh no, here it is, right here. Fun fact, the virus can remain inert inside the human body for 10 to 12 years. As in, somebody can contract HIV and not know it. Okay, now, having said that, after about 90 days, we can find it if you specifically look for it in blood. However, it can remain inside somebody's body, hiding out in the cells without any symptoms really at all for 10 to 12 years. So, yes?
Is it infectious at that time?
It can be infectious, yes, at that time. It may not be though, but it certainly can be. So yeah, somebody could have it, hiding out in the cells, no symptoms, and they could pass it along, but they don't even know they have it. So,
That's so scary.
yeah, that's a little scary. It's a little scary. Okay? So, all of these things, don't do them. Okay? You're probably good with blood transfusions and donating blood. If that's, I think it's been many, many years since we've had issues with that, at least in the U.S. They're pretty paranoid about that, as you can imagine. Okay? So, sepsis. What is sepsis? An infection of the blood, yes. However, if it was just an infection of the blood, we'd say bacteremia, right? If it was like bacteria, obviously. Sepsis is a really, really bad infection of the blood, right? So everything's, of course, on a spectrum in pathologies. Sepsis is way down at the other end here. This was one of the things that could lead to DIC. Remember that? When we were talking about DIC? This is one of the things that could lead to it. And if you look at this, it kind of makes sense. If you have a seriously, seriously bad infection, okay, massive inflammatory response, that's how it ended up causing the DIC. And then, whatever it is, bacteria, virus, fungi, whatever it is that caused it, it got really, really, really bad to the point where we're saying that's like a septic tank. I mean, it's that bad. That's what somebody's blood is. It's just nasty at that point. Okay, you would expect, of course, fever, tachycardia, tachypnea, heavy breathing, fast breathing, diarrhea. Sure, why not? It's a really bad infection. Altered level of consciousness. Again, when you start seeing an altered level of consciousness, as in kind of out of it, because of some kind of infection, that infection is really, really bad, right? Hypotension, and if it gets really, really bad hypotension, what do we say the extremely low hypotension is called? Shock, right? So, with the extremely low hypotension, that's what shock is ultimately, regardless of the reason. This is one of the many reasons somebody could go into shock, is their blood pressure dropped through the floor. Why? Because it's a massive inflammatory response throughout their entire body. Something really bad is in their blood. It's very high levels of whatever bad that thing is in the blood, and it just causes massive inflammation. The massive inflammation causes the vasodilation throughout the body. You open up the pores on those blood vessels. Fluid decides to just pour out of the bloodstream into the interstitium, and next thing you know, the blood pressure itself is just through the floor. Bam, you can go into septic shock. Cool? Already said that. Acute respiratory distress syndrome. Some of these, CBC is just your normal complete blood count, right? Blood culture, arterial blood gases, like what we were talking about when we were talking about acid bases. Why do I keep forgetting what this is? I was literally just talking about this yesterday, and I'm blocking it. I don't know what it is with this stupid thing. Huh? Yes, it is. It is a complete metabolic panel. Thank you. I don't know. Yeah. And of course, a urine analysis. Okay. So, one of the parts, one of the things that falls into the category of septic shock is, of course, toxic shock syndrome. I'm assuming we don't see a lot of this anymore. 20, 30 years ago, we actually did. Obviously the main reason was because women were leaving tampons in too long, they were getting infected, they were causing a direct infiltration into the bloodstream of some of the nasty bacteria. When you're talking about any kind of bacteria that tends to go septic, always think of the first things, the staph, of course, strep and pseudomonas. Those are like the big heavy hitters. Staph and strep are listed here. Of course, our group A beta hemolytic streptococcus, which was what we talked about, when we were talking about everything from strep throat to rheumatic heart disease to what we will talk about with the kidneys in a little bit. Okay? Altered level of consciousness is what this means. Again, we're at that level of, out of it. Okay? CBC, blood culture and serotype. Again, you want to know what it is, so you culture it, and you want to serotype it to find out what antibiotics will work for it, because as you know, when we're talking about MRSA, methicillin-resistant Staph aureus, is not just resistant to methicillin, right? It's resistant to a whole lot of stuff now. So you're going to want to serotype these bacteria to find out exactly what it is that will work on it. Because of course, if somebody's to a point where they have toxic shock, that kind of septic shock, their life is in danger, right? So you want to know pretty fast. Okay. Did we talk about syphilis before? No. No. So this is the first time we're seeing syphilis in this class. Okay, we will get back to it. What do we know about syphilis?
It's an STD.
It is an STD. Apparently, though, they changed it somewhere along the line to STIs, sexually transmitted infections. I don't know. We do that sort of stuff every once in a while. So anyway, what kind of patient? What are we talking about here? What's this person present with? What do they look like? Think about this in the form of a case. Who do we have? Male, female, doesn't matter. Nah, it really doesn't, right? I mean, obviously it's a sexually transmitted infection. Age? Probably someone old enough that they're having sex. So, why 22? Like 22. Okay. What are they presenting with? What is it? Why do they come to the clinic, hospital, emergency room, whatever? Might be itching and burning somewhere. With most sexually transmitted infections, that is the case. They may or may not with this one. This one isn't necessarily known for the whole itching and burning thing. In fact, in the first stage of this, what you'll see is this painless chancre. It's like think about like a wart that doesn't hurt on the genitals, okay? They may or may not come to be seen for that, okay? But that's the first stage of primary syphilis. Notice it takes 10 to 90 days to incubate. And then they have this lymphadenopathy. If you think about it, they're kind of sick, okay? They're just kind of sick. Lymphadenopathy, I mean, it's not like sick like we saw with the leukemias and stuff like that, but they might be kind of sick. They have this painless wart-looking thing, on the genitals. And if they come in for that, great. What's the treatment for syphilis, by the way? Does anybody know?
Is it a shot?
It is. Sure, everything's a shot. It doesn't have to be a shot, actually, but this is just penicillin, right? Like the most basic antibiotic ever, right? Just penicillin. Penicillin will kill syphilis. It's not very tough. as far as being treated goes. The trick is to get it treated, right? Who died of syphilis that you know of? I mean, I don't mean like if you happen to know somebody who died of syphilis. I'd be surprised, honestly, if you did, but throughout history, who died of syphilis? Does anybody know? You ever cover this fun fact? No? The infamous Al Capone. Al Capone, you know the mobster, the original mobster when we tried to abolish alcohol in this country? Didn't work out so well. And of course they arrested him for tax evasion, and he died in jail of syphilis. Okay? We know, because enough people have died of syphilis, how it kind of progresses. Okay? Does anybody know the sad reason why we really know exactly how syphilis progresses throughout stages? Rather kind of a horrifying way that we learn this.
Didn't they infect groups of people on purpose?
Yeah,
That one.
yeah, that was a whole lot of my rubber. So yeah, what, Tuskegee, right? So we said Tuskegee prison experiments where whether they gave it to them on purpose or not, I don't know. I know that it was over 100 black men in prison in Tuskegee, Alabama. That the government actually sponsored the research to, again, whether they gave it to them or they had it and they just watched it, I don't know. But basically watched these, again, you can treat this with penicillin. Watched it progress through all of the stages to see how they died, right? Just a really, really, really horrifying thing that our government sponsored way back in the day. Actually, it wasn't that, I guess it was like the 30s or 40s, maybe, somewhere in there, 1930s, 40s. Either way, that's how we know, unfortunately, on how this progresses through. When it gets to, again, it might not be that uncommon for somebody to make it through this first stage just because of the relatively odd and, I don't know, nebulous kind of symptoms that you would have. You get to the second stage, people, if they get a rash like that, they're probably going to go in and get treated, you would think. Okay, again, don't ever be surprised, but on what people won't get treated for. But yeah, you get this nasty rash. Now, this rash is also one of the big buzzwords of syphilis is on the palms of the hands and soles of the feet also. Okay, so when it gets to secondary syphilis, if you think about it, there's not a whole lot of stuff that will give you rashes on the palms of your hands and the soles of your feet, maybe eczema or something like that, but you know, the secondary stage of syphilis is also one of those things that kind of stands out. Yeah?
Can there still be treatment of the secondary
Yeah.
and like tertiary?
Mm-hmm.
Oh, so you can still live.
Yeah, you can still live. In fact, that rash will even go away. Now, this is the one where, again, it's not itchy, but, I mean, really? You'd be like, what in the world is this? I don't know, go get it checked out, man. Whether it itches or not, that's kind of ugly. Okay? Still kind of feeling ill, maybe a little more ill, right, at this point. Just they're sick and they got this rash. Is it really going to occur to somebody they have syphilis? Right? I'm just thinking, wow, that's a weird rash and I'm sick. Okay? Anyway. If, for whatever reason, it does not get treated in secondary, it can progress on to tertiary syphilis. And where we make the line of tertiary syphilis is whether or not it gets to the heart and the brain. Okay? So, gets to the heart, starts damaging the heart, gets to the brain, starts damaging the brain. By the way, we also call that neurosyphilis, the tertiary syphilis that affects the brain. What kind of necrosis do you think that's going to cause in the brain? Could you do this?
Yeah,
What does that even mean?
The mushy one.
The mushy one.
The
The mushy one. They're all mushy.
no, the
Huh? Caseous, think lungs, tuberculosis. What does the brain do to stuff that invades it?
Is it liquefactive?
Yes, liquefactive. Liquefies it, right? So, yes, you would see that. And this is also why when people go into the tertiary or neurosyphilis and it starts liquefying their brain, they kind of go nuts. And that's what they say happened to Al Capone too, is he just went insane in prison, from the tertiary syphilis before he died. Okay? Like I said, this absolutely can be transmitted during pregnancy, through childbirth, through the birth canal. Wait a minute. I just realized something. I was thinking this. Did I say when we were talking about putting the stuff in the eyes, was I talking about syphilis at the time or HIV? Yeah, syphilis. It's not HIV. I knew what I was thinking. I was thinking this, and I said it during HIV. Okay, my bad. Anyway, as far as testing goes, the RPR, rapid plasma reagent, also the VDRL, Venereal Disease Research Laboratory is what it stands for. That's another popular kind of big buzzword kind of test, VDRL or RPR. Okay. I think dark field microscopy is another one. I don't even know what a dark field microscope is, but apparently you can see the little spirochetes from syphilis. Okay, so here is the other thing. It says more or less the same kind of stuff. However, it can also go latent. So it can just kind of hang out, kind of like HIV can. That's probably how I got it in my head confused a little bit. Yeah, it can also go latent. It can just hang out there and just kind of do nothing for a very long period of time and then go active again. Okay? Questions, comments? I would ask stories, but probably don't want to hear any. Okay? All right, so let's do another case study. Uh-oh.